Awesome. So good evening, everyone. My name is Michelle Avila, and I'm the chair of the Health and Human Services Committee. This is Bronx Community Board 7's Health and Human Services Committee. I will pull up the committee agenda and read through it after I read through the executive ordinance. On March 21st, 2023, Mayor Adams issued Executive Order 363, extending the state of emergency through April 21, 2023. Accordingly, boards are able to continue to act under the state of emergency section of the video conferencing law, chapter 56, part WW. This allows the board to continue remotely. Minutes and video recording will be made available on our website. If you are calling into the meeting on a conference line, the controls are as follows. To hear all available commands, enter ** on your phone. *6 mutes or unmutes folks. *9 virtually raises your hand. How we will run this meeting is as follows. There's a code of conduct. Bronx Community Board 7 has the right to remove and or ask a member of the public to leave a meeting or block participation of anyone who engages in inappropriate conduct, including but not limited to obscene or offensive images or language, personal attacks, threats, or any other behavior that reasonably impedes the orderly administration of the meeting. Repeated offenses will be reviewed by the board's executive committee or any other assigned committee for a ban of the participant, the amount of time to be objectively determined by the above committee in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and authorities shall be summoned. Everyone besides a speaker or presenter will stay muted throughout the meeting. After each presentation is over, I'll inquire if committee members have questions. Committee members will signify that they have a question by pressing the raise hand button on the Zoom screen or requesting to speak through the chat or when the chair opens the floor. Members of the public who have joined through the online link will also be able to ask questions and make a brief statement on the item after each presentation. And after the committee has had an opportunity to ask clarifying questions by pressing the raise hand button on the Zoom screen or requesting to speak through the chat or when the chair opens up the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, granted that there is time and the committee agrees on the topic. Following the questions, discussion, and public comment portion, the committee will begin their discussions after each presentation agenda item and will conclude with the decision to vote on a recommendation if warranted. When the agenda is finished, the meeting will be adjourned. And if there are any questions related to meeting software or to our process, please use the raise hand function, the chat, or contact our deputy district manager. Thanks so much, everyone, for bearing with us through that. I'm really grateful to have so many folks on board tonight. I will share my screen so that we can look at today's agenda. Give me 1 second here. So I will take attendance in a moment. We will talk a little bit about some follow-up from last month, and then we'll go into new business, which will be reviewing the response of agencies for our budget requests, which was the process that we did earlier this year. We will call on our agencies and hospitals to see if they're in attendance and if they have any updates. We'll talk about any agenda items to bring forward to next month's meeting. And so with that, I'll stop sharing and I will do a quick roll call for committee attendance. Michelle Avila is here. Mr. Alfred Grant.
I'm here.
Awesome. Helene Wilson. Helene Wilson. Emmanuel Asamoah. Emmanuel Asamoah. Daisy Perry.
Daisy Perry, present.
Thank you, Daisy. Chad Royer.
Chad Royer is here.
Thanks, Chad. And Taina Pena.
Taina Pena here.
Awesome. Wonderful. And I see actually Helene coming in now. Just give her a second. Awesome. So thanks again, folks, for joining us tonight. We will have the opportunity to review the agency's response to our budget requests. Before we get into that, I wanted to follow up on two topics that were brought up during last month's meeting and one that's carried over. So starting with the sharp needle disposal, about 2 meetings ago, we had some discussion about the need for awareness for where sharps could be disposed of safely. This was brought by committee members and by Ms. Buford. And so a few of us collaborated with our district office staff on identifying some of the sites in Community Board 7. And we left off on trying to, one, create a list for Community Board 7 so that we can share with residents, and then also do a site visit to some of those sites to see what signage they have available, because one of our committee members noted that even at sites where there are needle disposal receptacles, the signage is not always in plain sight. So I again want to thank Chad and Toby for their work on this. And just to note that this last month was a little busy with some other board business, but I will be resuming the work around putting that list together for CB7 and then reaching out to see if folks want to do like a site tour and visit the different sites so that we can see what kind of signage they have and reach out to the respective heads of those agencies or hospitals, I should say, so that we can partner on just making it clearer. So I wanted to give that update. Are there any questions, thoughts, feedback on that? Awesome.
Yeah,
So
just one. I missed the last meeting pertaining to this, but with the needles, I believe that in the hospital in North Central, there's supposed to be, I believe, a container or something like that. I will follow through with it and let you know. But I believe that the hospital, the city hospitals were one of the main ones that should, if not, have that type of disposable for needles.
thanks, Alfred. Absolutely. And at that meeting, Mr. Alfredo Jones, who's here tonight, and we're so grateful, North Central's always on and showing support to this meeting. He did confirm that there is one in North Central and also followed up with a picture of where it's located. And so that's exactly what the committee wants to do. We want to kind of compile the list for the community. And then also if signage isn't readily like in plain sight, just maybe work with the different administrations to see if we can add anything or maybe put it on social media, just anything to bring awareness. But you're 100% right that North Central should have one. Hospitals are, I believe, required to. And so we'll absolutely be following up. And Alfredo, if you're able to unmute yourself and wanted to add anything, please feel free to do that.
Good evening, everyone. Not sure if you can hear me, having some
Hear
trouble
you.
with the audio. Thank you. Good evening, everyone. Yes, as you stated, Michelle, we kept that as an open item and wanted to return the response as quickly as possible since it kind of raised to the top, and it's one of those sort of urban myths and or legends that it's not readily accessible, and we wanted to make sure that the Community Board 7 team and other residents of Community Board 7 know that NCB, open 24 hours a day, 7 days a week, does have it is a red bin right in the lobby as you come into the right-hand side. No questions asked, right? Excuse me, it's the only barrier, I believe, is in the evening when, from a security perspective, we do lock down the front doors, but you can still enter NCB through the ED and be guided to the lobby to drop it off. So during the day, the large part of our, I think everyone being up and about, and that's 7 days a week, you can come right into the lobby. Just for security purposes, we do lock down the Cassuth entrance and manage everybody through the ED, and you can still access the bin that way. Hope that helps.
Absolutely, thank you. And Alfredo's right, they got on it really quickly and sent us a photo of where it's located. So North Central check, we just have some of the other sites, hospitals in our district to visit to confirm signage. So moving forward, last month's meeting, we had 2 discussion items. So one is partnership around a resource fair for folks that are caregivers to people with autism. And there were certain, there were a couple of ideas put on the table. One, can we reach out to the state and local stakeholders to see what kind of services and providers would be available to participate in a fair? Or at the very least, can we have some folks and providers at our resource fair that's scheduled already for the summer? So we did have our district office staff do some outreach, and folks are definitely open and receptive to partnering and tabling at our resource fair. And we can start discussion about whether we can do a larger event perhaps in the fall. So I did want to circle back and give that update as well. Any questions?
Yeah.
Go
Hi,
ahead.
so I couldn't find the raised hand. Maybe a suggestion for the resource fair in June. If we want to reach out to organizations like Include NYC, which is an organization that helps parents navigate the system with their kids as far as learning disabilities, and perhaps OPT or any other agency that deals with that demographic. Even if you have one of them, I think that would actually make a difference.
Thanks, Chad. I'm making some notes. And yeah, that's a really great suggestion.
I can email them to you as well.
That'd be great, Chad. Yeah, absolutely. Toby, I see your hand up.
Well, if we can get CUSAC involved, because they have been a provider of folks that live like on the autism spectrum since their inception. And there is a CUSAC school on 204th Street, just outside of Villa, across the street from Lehman College. And if we could reach out to them and have them be part of the resource that we're doing this summer, would be great.
Awesome. Thank you, Toby. Noted. Wonderful. So those are my updates. Thanks to all for contributing their ideas and meeting topics. I see AJ, same for Housing Works, or some kind of HIV and STI testing. Got it. Thanks to everyone for their contributions. We will continue kind of sourcing ideas from the committee for future topics, events, and we'll keep the good work moving forward. And so right into new business. So folks will recall that at the beginning of this term year for the community board, so starting in September, the board starts working on our budget request submission. And it's something that is very labor intensive and takes the board a couple of months to complete. We have a public hearing on the request. Every committee solicits feedback, and then we submit all of those requests, have a public hearing, then submit it to the city. The city then submits a response back to us on our request. And so we wanted to take some time to review what the city responses were for the items that pertain to this committee. So I'm going to share my screen now so that we can just take some time to review. And my goal with this review, if there are any issues or specific items that we want to reach out to agencies about, I'd love to kind of note that down, and we can work with the executive committee and the larger board to send any follow-up to the agencies. So can everyone see my screen? Does everyone see Register of Community Board budget requests?
I can
Yep.
see it.
I can see it too.
Yeah,
Awesome.
yeah.
Awesome. So again, these are the expense budget priorities and requests that we as a board submitted. So they're prioritized by what the board chose to be priorities. You have the request information, the explanation that the community board provided to justify the request, and then the agency that's responsible. On the right-hand side are the agency responses. So I'm going to put this full document in the chat so that folks can look at it. Actually, let me do that now. Apologies, 1 second. In case you can't see, you can follow along. Okay, it's in the chat. I'm only going to go over the requests that pertain to the Health and Human Services Committee. If there are other requests that you see that you're interested, I would recommend that you connect to the chair of the respective committee. If you don't know who that is, reach out to me via email and I'm happy to connect you to that person. So following that, our committee's first request is number 2. Our request was create or promote programs for education and awareness on preventing chronic diseases, including quitting smoking, nutrition, physical activity. The Department of Health, the agency response was, the Department of Health and Mental Hygiene is committed to helping New Yorkers live their live healthier lives and plans to continue fighting for obesity and physical activity programming contingent upon available resources. So that was their response. The next one is number 4, create or promote programs to destigmatize mental health needs and encourage treatment. The Department of Health and Mental Hygiene contracts with and oversees a wide variety of mental health and substance abuse services throughout New York City. Feel free to contact the department with specific questions about services. Our next priority was number 5, enhance naturally occurring retirement communities, programs, and health services. So the Department for the Aging will continue to advocate for increased funding support for aging services. That was number 5. Our next request was number 7. Provide more information and services related to STIs, HIV, AIDS, and family planning. The Department of Health and Mental Hygiene has a variety of HIV programs with a special focus on men who have sex with men, transgender women who have sex with men, Blacks, Latinos, and people struggling with substance abuse. We will review and assess the request for additional programming, which would be contingent upon availability of funds. I'm going to pause. Chad, you have a question about the NORC. Go ahead.
I'll wait till you finish. I just didn't want to forget. I'll wait.
Okay, awesome. So the next priority is number 8, create or promote programs to destigmatize substance misuse and encourage treatment. The agency will try to accommodate this issue within existing resources. Number 9, continue crime prevention and victim assistance programs for seniors. The agency will try to accommodate this issue within existing resources. Number 10, increase home delivered meals capacity. The agency will try to accommodate this issue within existing resources. Number 11, expand street outreach, and this is pertaining to unsheltered individuals. Street outreach services are available 24/7, 365 days a year by calling 311 or using the 311 app. When a homeless individual appears to be in need of assistance, any New Yorker can dispatch an outreach team to that person and help them move indoors. Funding for street outreach has more than doubled in recent years. Number 12, expand or enhance emergency food assistance programs. The Human Resources Administration continues to maintain funding for EFAP. During the COVID pandemic, funds have been added to the budget to purchase additional food. And the last one that I believe pertains to our committee is number 22, which is provide, expand, or enhance rental assistance programs and vouchers for permanent housing. Homelessness prevention is one of the Human Resources Administration's priorities. Funds have been allocated in the budget for these services. So with that, I will stop sharing and I will ask if there are any questions pertaining to agency responses or anything that the committee wants to discuss and initiate some follow-up. So Chad, I saw you have 2 questions, one on the naturally occurring retirement communities and number 9. So go ahead and unmute yourself.
Yeah,
And to pull it up again.
yeah, I also want to ask you to pull it up again.
Okay. Give me
So I was just looking at the response and oh, it disappeared.
Give me 1 second. Give me 1 second, Chad. I'm trying to pull it up.
Okay.
Okay, so you had said number 5 first.
Yeah, the naturally
Occurring retirement communities. Yeah.
right, right. So when they say the Department for the Aging will continue to advocate for increased funding support for aging, does this mean that there is a challenge with them looking for funding support, or they have a way of getting the money but don't know how to get started? It doesn't sound very clear.
It doesn't sound clear. I agree with you, Chad. How this reads to me is that there is not enough funding support for this. And so the agency will continue to advocate for increased support for aging services.
So maybe this is our opportunity, maybe even as private citizens, to add the flashlights to this item then, so that our electeds can see this as a request that we're asking for.
Mhm.
Yeah, back to number 9. Where it says continued crime prevention, victim assistance programs for seniors. The agency will try to accommodate this issue with existing resources. What resources are we using right now, with the exception of NYPD? I mean, is and I'm not expecting us to know this question, but have we looked at Social Security? Do people even recall that there was an actual Slam the Scam Day that was sponsored by Social Security? I think this is probably an avenue where we also might need to add some flashlights to it so others can see, because everyone's getting scammed now with different ways.
Yeah, Chad, thank you for that comment. I appreciate it. So when we were submitting these requests, both as a committee, Health and Human Services Committee, and also as an executive committee, we actually looked to see what the Department for the Aging offered, and they do offer some crime prevention and victim assistance programs for seniors. To your point, it's about expanding that, and that was our request. So I think we can reach out to Department for the Aging and ask more explicitly, like, how can we partner with you to advocate for more resources for these efforts? And if we want to bring some of these programs to CB7, I think we can make that request. I know to your point about a lot of older persons being victims of fraud and different scams, there are a lot of agencies that are doing outreach on this issue. So maybe that's something that we can consider doing a workshop for as well, just how to keep folks safe And maybe it's also something we can partner with the Public Safety Committee to do. So it'll be like both city agencies, but also from the NYPD's perspective. But thank you for flagging this.
Yeah, because I think Social Security, this is just my opinion, I think they would have a big play on this one. So that could be something that we can explore, reaching out to Social Security as well.
Thanks, Chad. I see 2 hands up, Mr. Grant, and then Toby, I see your hand up too.
Yeah, one of the things that I think that would be good for senior citizens, if there can be some mandatory, if not by the city council, to put for the apartment buildings to have workable camera systems in their hallways and locked doors getting into the building, because I believe that that would be something that if it doesn't stop, it will inhibit individuals from just robbing people, senior citizens in the hallways of their buildings, or even getting in the building. If that's some kind of way we could bring that to our politicians in the neighborhood, city council people, even the assemblyman, Mr. Denowitz.
Thank
Because
you.
I guess this is in the area of just some form of crime prevention.
Thank you. We can absolutely connect with Victor's committee, the Public Safety Committee, to workshop this idea, and then also bring it to Executive Committee and full board, Mr. Grant, to see, you know, how we make a recommendation, and to your point, use our elected officials to ask for, you know, measures that are going to make our seniors safer. So we can absolutely follow up on this one, and thank you for flagging that. I see Toby's hand up, and then Helene.
So 2 things. I recently worked with an individual who had to reinstate their SNAP benefits, and the COVID, the extra SNAP benefits that they were giving to folks during COVID, they're no longer given to folks. I just wanted to state that, because I believe you mentioned that they were getting extra money for COVID, and that stopped in March. I just wanted you to know that. And number 2, I just want to make us aware that people who navigate life with intellectual disability, most of these people have mild cognitive concerns, and a lot of time they are the victims of scams too. So if we could add folks with intellectual disabilities, or folks with disabilities period, into some of the language, I think that it would be more inclusive, the Health and Human Service, not the committee, but our language in what we write.
Thanks, Toby.
Okay.
Yeah, thank you. That's a point well made, and that seems like something we can absolutely incorporate in our recommendation. So thank you. Okay, I see
You're
Helene's
welcome.
hand up, and then I see AJ's hand up. Helene, are you able to unmute yourself? Oh, Helene?
Okay. Hello. I'm sorry. Something's wrong with my phone.
No
But my comment is also about the seniors and their safety. I went to a meeting 2 weeks ago with Senator Espaillat, where all the resident NYCHA leaders, and there was a lot of concern about unlocked doors, people loitering, hanging out, taking over the buildings, and things of that nature, and also stealing their meals on wheels. So that is another thing that we also have to make sure that the seniors are getting along if they don't get SNAP benefits. Some get SNAP benefits, some don't get SNAP benefits. They get Meals on Wheels. And if you got people that's loitering in the building coming and stealing the Meals on Wheels, if they're not home or they're at a doctor's appointment, that is food taken away from them. And that just cannot be. It's a lot of food insecurities amongst the seniors. I do take care of my seniors in Bailey houses. I fix Thanksgiving dinner. Sometimes I'll just cook Sunday dinner and just pass it out. You know, or when I go to the pantries, I make sure that I get an abundance of fruits and vegetables, and I come back to my house, I sort it out. I have my own plastic bags that I just knock on doors and get, because I also have paraplegics, I have people with disabilities, I have people with mental disabilities. It's not easy being a senior, and we must take care of them.
Agreed. Thanks, Helene. And thank you for letting us know about that meeting. I think I'm hearing a lot of concern about our seniors and the need to get information out and protecting them. So I think that this is definitely an area that we can collaborate with the Public Safety Committee and maybe see if we can do some workshops or events around this for our seniors. I also think that the organizations that we had at last month's meeting that were really focused on seniors are probably good organizations to circle back and reach out to see if they have programs or know of any providers that do workshops or events for our seniors. So thanks for the discussion. AJ, go ahead.
Hello, can you hear me?
Yes.
Yes, hello. I would just want to say 7 and 8 sound amazing, especially seeing how we have 2 major hospitals in the district and limited LGBTQIA services and providers. We live above 14th Street. Thank you so much.
Thanks, AJ. And I agree with you. I'm happy that the Department of Health and Mental Hygiene have a variety of programs. I think for me, it's reaching out to our reps for the Department of Health and Mental Hygiene and maybe asking them to share where these programs are, how we can access them, where they are in CB7, and again, how we can kind of share that information out to the community. So agree with you. Thanks so much. Are there any other comments, questions, concerns, ideas on our agency requests and responses? Awesome. If seeing no hands, we will go into city agency and hospital updates. So do we have anyone on from the Department for the Aging? Do we have anyone from the Department of Health and Mental Hygiene? Do we have anyone from the Mayor's Office of Immigrant Affairs with us? Anyone from Montefiore? I did want to say that Montefiore has their neighborhood advisory board meeting usually scheduled during the same time that we do. So their rep reached out and said they apologize for not being able to attend. If there was any follow-up item to please let them know. And so we're in communication. Over the summer, we will talk to them and ask if they can figure something out in terms of streamlining some of the communication. But I know that they have an email list that they send workshops and events and to the board directly. So just wanted to note that. And do we have anyone from North Central? I think I saw Alfredo, and they're always here to give updates. So appreciate you all.
Thanks, Michelle. Good afternoon and good evening, everyone. We don't have too many, but a few that I wanted to bring up. One was, as we have different signs of coming out of the COVID pandemic, one of the things that sort of touches the community, touches the healthcare facilities, is access to insurance. And so there was kind of a moratorium for the last couple of years on folks being able to move around the various insurance payers that we have in the systems. One visible change you're going to see that NCB is in the lobby. We have always had and will continue to support Metro Plus as an insurance product of the city itself. But one of the second highest insurer, particularly for NCB, is Health First. And we've now started a partnership with them, and we'll have a representative in the lobby twice a week, Tuesday and Thursdays, for anyone in the community who may have a question for Health First. And if you have not had the opportunity to have a face-to-face, here's your opportunity. You can meet them right in the lobby, and they're actually stationed right next to the Metro Plus table. The way that it's supposed to work is that they are supposed to work for you, you, the patient, you, the community, to get you the correct and best insurance coverage. I always encourage kind of healthy competition is what I call it, right? Because not every insurance fits every person's situation. Some of us who may have young children, some of us may have older children, some of us may have seniors that we care for. And those are interesting and very unique dynamics that force the insurance companies to kind of build a plan around you. So just wanted to make that announcement. Health First, as of this week, literally today was day one of them now sharing the lobby at NCB, and that's Tuesdays and Thursdays. Something else, the two other things that are going to be visibly.
I'm sorry. Regarding the insurance coverage, have you all been briefed on the Medicaid unwinding issue? And is that something that maybe we can bring to May or June's meeting?
I can definitely tap on that shoulder. I've gotten not enough information is how I'm going to respond to that one. We've heard of it. Don't have enough detail to be a good resource for CB7 at this time, but we can definitely work on getting more.
Awesome. Perfect. We can connect via email as well. And just folks, really quickly, just to give a heads up, because a lot of the COVID emergency, like public health measures are coming to an end on the federal level, on the state level, there are some expansions that are going to be rolled back, and this includes Medicaid coverage. And so that is happening all over, all 50 states. New York gets to decide how they notify folks, and they're supposed to be working with providers and clinicians so that there's, like a seamless, hey, this is going to be ending. These are your options. We know that doesn't always happen so seamlessly. So we're waiting to see what the federal government, what New York State does. And so it's not an issue that I think, even to what Alfredo is saying, we have a lot of information, but we'll definitely bring it to the committee as we get more clarity. So just wanted to mention that. But sorry, Alfredo, go ahead. Thanks for offering that.
No problem. And very good point. Very, very good point. Two other sort of visible changes that will be coming to the facility. One is one of our multitude of projects. We have a number of construction projects. I've mentioned it a few times, and I think you're going to finally start to see the physical manifestation of one of them, which is a local law 11. It is us upgrading our facade. So this is a facility that was built in 1974, and it does need some touch-up. It needs a little bit of TLC, right? And so that's going to begin in the form of, first, and here's where the visible change will be. We have to put up by the Department of Building Codes, we do have to put up sidewalk sheds, AKA scaffolding. Unlike scaffolding that we've seen throughout the city, we currently have a mayoral administration that is not fond of scaffolding beyond the true needs of that safety device, safety equipment. And so the expectation is once it goes up, which will be this year, likely within the next 60 to 90 days, once it goes up, The goal is to have all the work that is associated with our concrete and bricks on the outside will be completed by December of 2026, and that the scaffolding will come down shortly after that. That is an aggressive goal from what I understand, a goal that we invite. That way we're not shrouded in scaffolding for too long, and folks remember that we are still here and still available. Some of our projects around this scaffolding is figuring out how to still provide handicap parking, right? Because this is going to impact us from 210th Street all the way down Kasuth, next to our partners, which is Montefiore. So just from an address perspective, we're known as 3424. They're known as 3444. And we're separated literally by a wall. And the construction sidewalk sheds, AKA scaffolding, will last from the loading dock on 210th Street, where 210 and Steuben meet, and will curl all around the hospital, all the way up to Kasuth. And I believe the meeting point is Kasuth and DeKalb. It's going to go as high as 3 floors. My background is actually NCB. And if you can see that the bottom of NCB sort of has almost like a lip that sticks out, that's as we understand it from today, that's how high the scaffolding will raise. This is just a blemish on the look of NCB on the outside. It does not impact anything on the inside. All right, so I kind of wanted to make that clear. I did see a hand go up.
I think Alfred had his hand up. Alfred, is this a question for Alfredo or unrelated?
Yeah, I just want to get verification on the area, and I know we didn't talk about that, but I think this is the right time. And because of COVID-19, and as the president and everybody and the mayor and the governor is leaning off laxing the COVID era. So the question I would ask is, are the masks optional or still mandated in certain areas?
Well, for NCB and all of H&H, they are mandated in patient-facing areas. Outside of that, it is up to the individual. We continue to offer in the lobby as soon as you walk in, but depending on where you're going, what you're doing, what's your business in the facility, it then will guide whether or not you are requested to don one or not. And that goes for staff as well.
Got you.
Thanks, Alfred. Chad, did you have a question for Alfredo? Chad, you're still muted if you're speaking.
Oh, I'm sorry. It was for Alfredo. Good evening, Alfredo.
Hey, Chad.
So I'm actually familiar with local law 11, and I know sometimes those things can get delayed due to circumstances out of our control. My concern would be the accessibility of folks on the sidewalk with wheelchairs or who would need to use strollers. I'm just hoping that in the process of putting up the sheds that they don't create incidental blockage for those who require those kind of mobility. I know there's some areas where they put the sheds and they could be very sloppy at doing it. But I just wanted to raise that as a concern, even on a short-term time period.
Chad, good point. So to answer your question, that actually was considered, hence the additional consideration even of the parking spaces, right? So the front, for those of us familiar with the front of North Central, we have a small number of parking spaces. Of that small number, I want to say, as of today, 3 are dedicated to handicap parking. And so we're trying our best to retain those spots. And if we can't retain them, relocate them to other areas. So the interesting part of the local law 11 project, there's nothing etched in stone, right? The vendor hasn't stated very clearly as of yet where the posts are going to get set up. And they continuously reassure us that they're going to leave us some sort of handicap parking access, but they haven't been detailed enough to tell us which ones. That being said, they are extremely sensitive to the fact that we have strollers, wheelchairs, rollators, walkers, accessoride, women in labor, women postpartum. And so all of these populations that we serve, right, had to be part of a very early part of the conversation. And so once the vendor understood that, we're kind of waiting for some diagrams to see what it's going to look like. I just know in detail the length of it. I don't necessarily know the width of it. If they're going to absorb the entire sidewalk, in that case, you still have the entire sidewalk. It's just covered. Or do they just take a component of the sidewalk? And those are the details we're sort of waiting to figure out. And I did see something pop up from Mr. Artist, Mr. AJ, the artist. No, I wish I could tell you that it's going to get a full facelift, my friend, but it's not. It's we're just going to do some brick pointing and get it more updated. Interestingly enough, when the construction does happen in future state, which is years from now, so I hope that I'm still here able to give some pictures of that project. There will be some major internal construction. Right now, we're just getting ourselves back up to code on the external side.
Thank you for that.
Absolutely.
Yeah.
Alfredo, any other updates from NCB?
Actually, yes, two more. Just one is, this is early, but I don't want anyone to walk in and kind of be thrown off. And similar even to the Medicaid conversation, this is hot off the press. I don't even think it's a week old. And so we're lacking some detail, but I want to be transparent and forthcoming. Many of our hospitals have been moving to different technology in our entrances. NCB will be is in line to receive some version of a weapons detection system to allow hospital police to sort of have technology help them before there is a need to interact and or interject, right? So I can tell you we currently have processes where folks are searched when they enter certain areas of the facility, but that's not an expectation across the board, right? And I think that what we've seen, unfortunately, what we've seen over the last couple of years, right, is there's increased moments and incidents of violence. And this is sort of one of the system's ways to respond using technology versus using many, many more people that I don't think we currently have the bandwidth to even recruit, right? That's a whole nother project that we have lined up. But Jacoby did go live with this first. So we're kind of learning from our sister hospital how this should go. And I believe even Lincoln is either slated or already has it, but I will bring more information as we learn more. This literally came to us last week. And so I'm sorry, I can't bring pictures or more information, but I do want Community Board 7 to know this is coming. And sometimes these projects happen within the number of hours, and I would have felt terrible that I didn't give folks a heads up on this forum. And before our next meeting, it would have popped up and you wouldn't have known. And that would have been, in my opinion, too late to give you that update. And yes, it is like a strange TSA experience. I actually experienced it myself, but you wouldn't even know it's there. The technology is pretty advanced. You just kind of walk through and keep walking. If you don't have to be searched or spoken to or interceded, then you're not, right? You just proceed forward and you go to wherever it is you have to go. And that's really for everybody. It's a conversation for both, and it's an experience for both patients, visitors, staff, everyone. It's an all or nothing sort of conversation. And then lastly, I did hear a SNAP conversation. And one thing I did want to mention for those individuals who do have or are eligible, right, for our supplemental program known as NYC Cares. NYC Cares is launching a new arm. It's a new benefit, and it does map into SNAP, where it does have credits for SNAP. I'm trying to pull it up.
Alfredo, I'm just putting it in the chat. You're talking about the to go.
Groceries to go. That is correct. Yep. So we're excited about this too. Is very, very new, right? And so our NYC Cares insurance coverage now offers an additional benefit. I do know that there is an additional, I believe that the percentage is around 30% discount for those who are eligible and are enrolled to NYC Cares when it comes to accessing groceries. I kind of stole my snippets earlier today, yes, from our public affairs folks. Thank you, Michelle.
No problem. I'm trying to make this bigger. Apologize. Give me 1 second. And I think it's 50% is the percentage.
Oh, yes, you're right.
Yep. Okay, perfect. Thanks all. Do folks see it? So we just put that information in the chat, and there is a number and a website to go to if you want to ask if you're eligible. It's 347-665-0175 or nyc.gov/health/groceries to go. We will absolutely share this information out with our board staff so that they can include it in the e-blast. But really big thank you to Alfredo, you and your team for making us aware of this information. And yeah, we're really excited to see this. We know that the additional food support is drying up, especially as some of the emergency funding and programs end. So this is really much needed.
Absolutely. If there's any other questions, please don't hesitate to reach out, ask. I'll still be here for a few more minutes so I can kind of follow the chat if folks don't want to interrupt the flow of any other conversations. And Michelle can always reach me.
Thanks so much, Alfredo. Thank you.
Anytime.
Being such an amazing partner. We do appreciate North Central. You all are always here, always bringing your expertise, updates, timely updates. And so we really, really appreciate the partnership.
Same here. Thank you.
Thank you. Okay, so we've gone through most of our agenda here. I see folks are adding information in the chat. Thank you so much for doing that. So our next meeting is Thursday, May 16th. Are there any topics that folks would like to have a presentation on, or anything that folks want to put on the agenda for next meeting? Okay. And any other questions? Yeah, go ahead.
Yeah. Perhaps a follow-up with the rat situation, the hiring of the rat czar, the rat academy, perhaps some updates on what's happening with the rat population.
Thanks.
I mean, that's the thing I can think of right now.
Yep. Thank you, Chad. So we can reach out to Environment and Sanitation Committee to maybe have like a joint meeting or joint update on that. We are working with our wonderful board staff to facilitate a training. We want to do it in person and are looking at dates over the summer. So we'll definitely have more on that. But we can absolutely see if there are any updates on what's happening with the rat czar, any policies, you know, how that's going, and anything that we can do as we prepare for the summertime. So appreciate it. AJ, I see your hand up. Go ahead.
Yes, especially seeing how we don't have the Bronx Week of Marshalloo this year and the new bike lanes. There's going to be so many more people active this summer. There's no garbage cans. I believe that rat training would be a lovely thing to have. Thank you.
Thanks, AJ. Agreed. Awesome. I'm gonna also note this for our executive committee meeting on Thursday. So thanks for flagging. Awesome. Anything else before we adjourn? All right. Is there a motion to adjourn?
I move to adjourn the meeting.
Thanks, Chad. All right. Second.
Oh,
I second that.
wait,
Motion.
I just have something.
Thank you, Alfred. Before we adjourn, sorry. Are there programs for doulas? Leslie, are you asking within North Central or just in Community Board 7?
Community Board 7 or also North Central Bronx.
Yeah, so let me see. Is Alfredo still on?
I'm still here.
Alfredo, are you able to speak to this?
I am actually, I flat out as it is right now, we do not, but our, and she was featured here, I think once, our leader, our clinical leader, Dr. Wampa of OBGYN, right? She has been exploring how to bring doulas onto NCB's OBGYN team. It's easier said than done as we're starting to learn. But that goal is one of her leadership goals, having taken on that department. So I do hope to tell you in the future that that has changed. As of today, we do not, but there is a push to bring doulas on.
Okay, thank you.
How can we help?
That's a great question. And Chad, I'm going to hold you to that. I will go back to Dr. Wampa and find out where she is in the process. We may need your voices to help her get over the hump. As it stands, she hasn't expressed any barriers other than the lengthy process of sort of being approved to onboard and having the right sort of curriculum and resources. But there may be something political that I'm just not aware of. And I will lean on you folks as a resource.
Sounds good. I'm here to help.
Thank you.
All right.
Thanks so much. And I'm gonna put my my email in the chat. Leslie, I can ask to see if other hospital facilities in Community Board 7 do. I don't know, but we can look into it. And Helene, of course, thank you. Helene, go ahead.
Yes, I'd like to know, what is a doula? I've never heard of that. Is that what you said?
Yes. Doulas are, if I'm not mistaken, they're almost like a midwife, and they're basically important because within the Black community we have a high rate of maternal or fetal deaths.
Yes,
What
I'm
a
aware of
doula
that.
provides is the emotional support as well as comfort. It's a soothing. I mean, they're there, they walk you through the process, and it's almost
Okay.
like having a midwife. However, you have a better
Okay.
outcome. There's more better outcomes as far as births with
Okay.
women who have used doulas. The city is trying to initiate a program, and I just wanted to know whether Community Board 7 was a part of the program. I know that the city is trying to initiate a program to have doulas more affordable and accessible in communities, as well as trainings to become doulas.
Okay. Okay. Thank you for that. I also wanted to bring the attention that yes, it's spring into summer. There's more garbage generated, and there are no garbage cans on Kingsbridge Road. Period. Nowhere can you find a metal trash can or any type of receptacle,
Thanks.
and that's something we need to work on.
Yeah. I can relate that also to Betty from Environment and Sanitation. So thank you for flagging that.
Yes.
Alfredo, did you want to add anything to the doula conversation? Leslie, you did an amazing job explaining.
Yes.
Yes.
Yes, she did, because I had no
Yes, yes, she
idea what
did.
it was. I had no idea.
Yeah, I think it's hard to top Leslie. She hit the nail on the head. It was, I learned it actually the way she explained it, right? Your midwife is like your medical person, and your doula is your physical, spiritual, emotional
spiritual,
person.
yep.
And they actually interact even more with your family, with your own support system, versus your midwife is very sort of a one-to-one interaction. At least that's the way it was presented to me.
Thanks so much, Alfredo. And Toby, I see your hand is up.
I remember some time ago there was a push to replace the existing metal garbage cans with a more sturdier type garbage cans that will prevent two things: people from going in to get out bottles, and also it's supposed to help with the rats. I can tell you that some are in DeVoe Park, but yes, for some reason that never materialized, because you're right, there are no garbage cans along Kingsbridge Road, and there are barely any along Fordham. So it's a concern.
Yes, it is. Very much so.
Thanks, Toby. Yeah, I definitely am gonna take both the rat piece and the garbage receptacles to our executive committee meeting so that we can liaise with the Environment and Sanitation Chair. So thanks to everyone for bringing this up, and we can see, you know, what we can do at this point. But really, I hear your concerns, and yeah, we don't want to get into the summer like this. So thanks all for sharing the feedback. Awesome. So if there are no other comments, I heard a motion, I heard a second. Committee, all in favor of adjourning, if you could please say aye.
I was talking about myself.
Aye. Aye as well. All right, y'all. Thank you so much. Really appreciate your time and dedication. We will see you during the general board meeting and at next month's meeting. Thank you. Thanks, Leslie. Thanks, Alfredo. Thank you, everyone.
You're welcome.